You might have heard my other videos where I really encourage people to ensure that they use their hospice benefit. And I'm going to talk about the reasons why. Maybe some of them are kind of obvious. You're thinking medical care, but a lot of them are not so obvious to the general population that you really need to know about as part of your given hospice benefit. So let's get into that today, and we're going to be covering why you need to make sure that you don't die without hospice. So welcome back to another video. This is Abigail. I'm here to normalize conversations and education about death and dying so we all die better at end of life. And I really want to talk to you about why you need to make sure you access your hospice benefit at end of life when you are in the end stages or your loved ones in the end stages, nearing death, etc. So I'm going to kind of start from some general things and get into more specifics. And I doubt that you know about the specifics if you're a person that is not at all involved or aware about hospice care and what it entails. So the first things first, I want to start from the insurance aspect because that's always a very critical thing to understand. You have to understand that you've been paying into this. If you've been paying taxes, you've been paying into this. So this is a benefit that you definitely want to use. You actually don't have to pay for hospice care, but you certainly are paying taxes, and you have been paying taxes for some of your life, or if you've been in the workforce, probably for most of your life. So you really want to get the benefit that you paid for. For commercial insurances, you can also access hospice usually for free. The only thing that I will say for Medicare, Medicaid, and for these other commercial insurances, things have gotten a little complicated, particularly in the States. And people have secondary insurance, people have insurance for room and board. So especially if you or your loved one is in a nursing facility, a skilled nursing facility, and that's where you or your loved one resides, room and board coverage can be a little bit tricky depending on the insurance. So you can always just you can talk to your insurance, but probably the easiest thing to do is ask the case manager at the nursing facility or ask the admissions person, the person that actually works with people who are being admitted to the nursing facility, ask them about your room and board coverage in relationship to hospice care if you were to start hospice care. So that's probably the best thing to do because I can go over many of those scenarios, but again, the insurance has gotten just more complicated and just a little bit more layered, and I really want to make sure I don't miss anything for you because it can be so individualized. So the easiest thing to do if you or a loved one is in a nursing facility, you really want to make sure to talk to the nursing facility case manager. Sometimes the nurses know, but I would talk to the case manager or the admissions department at the facility. Okay, so when you access hospice care, though, the actual care should be for free. The first meeting, for them to come out there and do either kind of an informational visit or an evaluation or even an admission is always for free. So if anybody tells you that there's a charge or they expect some kind of payment, you need to understand that all of this stuff is for free. So when it's covered by your insurance, hospice care is for free. There are some other kind of concierge type of services that people might mistaken for hospice or certain kind of concierge services provided by physicians nowadays. That's different. That's a concierge service. That's not hospice care. They may specialize in end-of-life care. They may have a certain specialty or say palliative certification, things like that. But that is different than hospice care. So make sure that you are talking to a certified hospice company. And I will talk about how you access care in another video, but I want to talk to you about why you need to have hospice care. So first of all, you paid into this benefit. It's part of your insurance. The care related to hospice and all the hospice stuff, there are hospice conditions. So anything related to your end-of-life care, the death and dying process, comfort, that is all covered. So what's kind of the stuff that you can get? Let's talk about the stuff, right? Because the stuff is important. So big things, medications, most medications should be covered. Medications particularly that are for things like comfort, like for pain, to treat other symptoms like nausea, vomiting, constipation, diarrhea, anxiety, breathing issues like shortness of breath. all those things for medications, in terms of medications, must be covered by the hospice. So you don't have to be paying those out of pocket. Okay. There are now more and more, hospice is expected to cover more and more. Not necessarily everything, because if it's a medication that is for a cure, so if it's a curative focused treatment like chemotherapy, chemotherapy pills, or if it's for a condition that is really not related to hospice care, that is getting more and more tricky as time goes on. Hospice really is, extremely holistic, and it's covering more and more things. But sometimes the hospice personnel may say, this isn't really related to your hospice care. Have them explain to you why. They are supposed to provide some paperwork to explain those types of things. Particularly on admission, you have an option of getting some paperwork about that stuff, about what's covered, not covered. I would always choose to make sure that you get paperwork, when there is that option, because, at admission, you are just overwhelmed emotionally, probably physically overwhelmed because you're exhausted, mentally, all this stuff. You're trying to process it. Always, go for the paperwork so you have something in writing and you can actually refer to it later on. But when we're talking about hospice care and the actual comfort care and all that stuff that's related, all those medications should be covered by hospice. Durable medical equipment, which is basically medical equipment. So things like, the essentials related to end-of-life care. So a hospital bed, when the time comes and you or your loved one need a hospital bed, they can bring the medical equipment company with whom the hospice contracts will come to the home, the nursing facility, whatever it is, provide, the appropriate bed. And it's usually like a bed that can move the head up and down, the feet up and down, usually depending on the rules of the facility and, other kinds of things. It may have side rails that kind of go partially up around the head. It depends, they're, again, certain things are always changing in medicine. Side rails, while they may seem that they are really protective, there are certain precautions we need to take for safety because some people have been injured. So just be aware that, what I'm saying is I'm trying to speak as general as possible while giving you as much detail as possible because state by state, things may be different. Things may be different according to a facility, a skilled nursing facility versus a hospital versus a long-term care, facility, independent living. All those things can look a little different, okay? And certainly, if I didn't cover something or if something is not clear, please put a question in the comments. I read everything, and I really want to make sure to be, responsive and give you the information you need. This is all about you guys here and getting the information you need so that we die better, right? And so the other equipment that you can get, which is really cool, you can get oxygen, and the thing about this stuff too is, when I'm talking about getting, things like your medicines and medical equipment, things like that, you can get that the same day you're admitted to hospice, depending on the urgency. But, you can get that the same day you're admitted to hospice. If it's needed, they have to provide it. So that's the really cool thing. So if you're being, if you or your loved one is being discharged from the hospital back to home to receive hospice care can meet you at the home. They can even meet you at the hospital, prepare your discharge, have someone come, what we call do a tuck-in visit. They come tuck you in and make sure that you've got everything you need. You get, things like your oxygen, your medications delivered. They do some education on that. And you can get that done all in one day. And that is a really amazing thing about hospice. So this is why I think it's so important for people to understand. Hospice is supposed to act quickly, because Medicare, the insurance carriers understand that time is of the essence when we're talking about end-of-life care. So we're working with someone who has a limited prognosis, meaning that they're not going to live very long, so time is of the essence. So hospice is supposed to act quickly. So this is not like too good to be true. This is something that you absolutely deserve to have. Other types of equipment, because we've been talking about that and want to stay on track. So we talk about like a bed. We talk about, things like oxygen, other types of equipment like a bedside table, one of those cool tables that kind of goes up and down, can go over the bed so that the person can eat comfortably or, reach for their personal items comfortably. And it's a really nice handy bed, especially if the nurse is coming doing wound care, things like that. That's a really nice thing. Wheelchairs are, usually cover the basic wheelchairs. Sometimes even a recliner chair, it kind of looks like a big easy chair, a big recliner chair. And those things actually can be wheeled around too. And what's nice about those is you can actually, put your head back and put your feet up so you can rest comfortably, and then also get up a little bit more comfortably depending on, the ability of the patient. Things like also a bedside commode, which is basically a bedside toilet. So it's has handlebars, and it has a little bucket in the middle with a lid, which is good, so you can always close the lid once someone has gone to the bathroom, and then you can empty out the contents in the toilet. So, but what's nice is that you can have it right at the bed. So the person who is on hospice doesn't have to make the big trek to the bathroom, which may not seem like much right now, but it could seem like a lot, as they're declining and getting weaker. There are greater risk for falls and things like that. You likely you minimize, you're walking as you're declining, obviously, because you're getting close to death. And other things, there are many other things like wound care supplies or supplies to help with certain drains or things that you may have related to any type of end-of-life care and comfort, and those types of diagnoses. So those things are all covered. Those are things that you don't have to purchase yourself. Those are things that you don't have to go out and get yourself. These are things that actually come to where the person who is on hospice lives, whether that's at a home, whether it's at a skilled nursing facility, whether that is at a long-term care facility. So please know that there's so much that is available to you. The other things hospice can provide that sometimes people don't always think about are things like adult briefs, or, the pads that go underneath somebody that can protect against, unexpected incontinence, whether it's, urine or fecal matter, those types of things to help protect the sheets. So those are really good things. And even some basic, some other basic type of personal care items. What will not be covered on, and again, I think for some people this is also kind of a case-by-case scenario, but really need to emphasize that everyone should be doing most of the things the same, particularly, some of the basic essential things. Depending on state, again, I know, and depending on the hospice, it can be different. But things like these specialty beds or like a really fancy specialty wheelchair or a really fancy specialty mattresses. There are mattresses that are covered, especially if someone has high risk of skin breakdown. So if they have like wounds on their skin from being in bed a long time, hospice will provide a low air loss mattress or something like it to help protect the skin. That should not be charged to you. But there may be some things that are more kind of considered out of pocket, which are kind of more luxury items. So like the really fancy beds with the cool colors and all the cool buttons, and they might turn the patient for you, things like that. On occasion, I've seen maybe people consider covering those. It really depends on, again, the medical condition, the medical specification for these things. But anything that's like super fancy in terms of just for luxury or, something that just you prefer just because you like the way it looks or something like that, that isn't always going to be covered by Medicare or the insurance under hospice because, hospice is already providing the essential wheelchair, the essential recliner chair, the essential bed, things like that. So, if you have questions, if something else pops up and you're like, oh, my loved one has been using this for a while, is this something that's covered? And also, if it's something that's already pre-owned, you don't have to worry about that. That's already pre-owned. You've got that taken care of. But if you are using something that is that you may think might be a little bit outside of this kind of the basic stuff, and you're getting it or you're renting it from another company, then you'll talk to hospice about that, and you'll see whether that's related or not. Again, if anyone says that, something is not related to hospice care and you have to pay out of pocket, get something in writing, make sure you understand it, and make sure you ask questions because you really want to understand why something is not covered for hospice. And there are very good reasons as to why certain things like medications and things like that are not covered. And I will get into that in another video because it is really important to understand that. The other kinds of things that I think is really cool is, so if you have an emergency at home, say the person who is on hospice maybe is a little confused and they tried to get out of bed one day. And maybe it's at night, 2:00 in the morning. Of course, all these you know, as we know, emergencies happen at the worst times, right? Like at 2 o'clock in the morning, never when we have a free moment, never when we have time to take somebody to the emergency room, right? So say, the person, dad who's on hospice, he gets up in the middle of the night because he has to go to the bathroom. This is one reason that we talk about preventing falls, which I will talk about. So he gets up and goes to the bathroom in the middle of the night and he falls. And he ends up maybe breaking something. We're not quite sure, but then when you go and see him, one of his legs is turned in and kind of looks a little short. Kind of a classic sign of a hip fracture, by the way. But so usually on those cases, you just like panic and you're like, oh, I got to call 911, right? And that's kind of a default to us. And this is why if you've ever met with hospice, they talk about not calling 911 if, depending on your medical wishes, if you're choosing comfort care strictly, you don't call 911 anymore. You call hospice. Of course, talk to your team about the appropriate thing for you. Typically on hospice, someone is a do not resuscitate. We're really pursuing strictly comfort care and comfort measures. So we're not going to be going to the emergency room. And you can see my videos on why going to the emergency room in hospitalizations in general is just not a really good option, particularly at this point in hospice care, because there are really found and legitimate reasons why. But to get to the reasons why you want to use hospice is because then what you do is hopefully hospice has kind of taught you something of what you can do in the meantime, make that person comfortable while you call hospice, and you let hospice know, hey, my dad just had a fall. He's on the ground. His leg looks a little weird. I'm not really sure what happened, and he's not really responsive. And I think he hit his head. I'm not really sure, but can you please come out? And hospice must send a nurse out. And what's great is that you actually get a nurse that comes out and assesses the patient. And if he needs to be moved, they'll work with their team, or what they'll do is they'll work with the local fire department, depends on each city, state, and get him back up into bed safely. It's not your job to necessarily move them because, especially if they had a fall, they could have fractured something. You need to really take care with all of these types of, issues that could happen at the time. So they can help you get dad back into bed. They'll assess everything again, make sure he's comfortable, because if he's having some pain, make sure he's comfortable, and then talk to you about next steps, especially if a fracture has occurred. Are you going to be sending him to the hospital? Most likely not. When we're talking about somebody who's dying, you're not going to send a dying person to the hospital to fix a fracture. And again, I get into this more, but this would be a futile exercise and would cause more discomfort, more confusion, more anxiety, and could even hasten death in a person who's dying, because a person who's dying shouldn't be having these curative types of measures. Now, if it's something, sometimes wacky things happen, and it's something where you have so much pain and you've got to do some kind of traction or something with that fracture, and it really needs a doctor to set that up, maybe, but most of the time, no. So my bottom line here is to say that when an emergency happens at the home, nursing facility, wherever, the hospice will come to that place at any hour of day or night and provide medical care. They already come regularly, but they can come in an emergency. Say all of a sudden this person starts to experience a seizure. Say all of a sudden they start to experience a lot of pain. They all of a sudden start to experience a lot of anxiety, confusion. They start yelling out. Any of those things. Hospice can come and address the emergency soon. Now, soon can be relative to the person. If you are a person, if you have a home and you live kind of on the outskirts, it may take them a little bit longer to get there. So the time frame, it depends on the hospice, and it depends on, where people live, where they're coming from. I worked in San Diego County, so it's a fairly large county, and there are certain people that are on the outskirts. But, it really, again, depended on, where the nurse was at in the middle of the night, if they were already treating an emergency. And so they could get there sometimes. If they were really close, they can get there in, 10 to 15 minutes, or it could take an hour or so. And this is why when you're working with hospice, you talk about your emergencies, right? And you talk about what you do in the, in between, when you're calling and you're waiting for somebody, they should be telling you what you can do. So that's a great benefit to hospice. And this is why, again, you don't want to die without hospice, because you may think everything is under control, but unexpected things happen in hospice, and you need to make sure you have access to the appropriate care, end of life care, that can help you, walk through this entire journey with all the support that you need. And the other thing I want to emphasize here, and just really just say it again, that they come to you. And this is a really beautiful thing about it. The professionals are coming to you. So let's talk about the actual professionals that are actually on the hospice team. And this is a really, I always find this just wonderful. Hospice care is, deemed a very holistic type of care, right? So you don't just have medical, nursing, clinical care. There's a lot more than that. Of the nursing care, you are always assigned an RN case manager, a registered nurse case manager, that is overseeing your entire case. So they are working with the interdisciplinary team of other members and helping kind of coordinate care with you and overseeing your care in its entirety. And then, when this RN case manager is off, if it's outside of business hours, you have on-call nurses that work, at night or on the weekend. I'm sorry for the extraneous noise that's been popping up now and then here. And there are other people on that nursing staff, and that could include licensed practical nurses, licensed vocational nurses, depending on what state you reside, and nurse practitioners. And nurse practitioners I'm going to talk about when I talk about the medical doctors and PAs and things like that. And then you have nursing aides, and the nursing aides are probably some of the staff that spend the most time with the patient who is on hospice. And they provide some of the most dignified care that I've ever seen, as a hospice professional, nurse, and director. I've always treasured my hospice aides because I've always asked them their opinions on things, because they would give me so much information, especially when I was assessing the patient, really trying to determine the safest durable medical equipment. They're able to give me input because they're there. They see, what else the patient's doing. Sometimes they get the best stories from the patients when the patients are still conversive. So I just can't emphasize how important they are. But they not only do personal care, they do some of the best, nursing aides I've seen are hospice nursing aides, because they do head to toe personal care beautifully, but they also can be trained in things like healing touch and energy work, things like aromatherapy. So, it's when my nursing aides were all trained that way, and we had someone at the company train them, it was so great. And I was able to talk to them when they were seeing a patient and say, well, use this aromatherapy oil. Let's try this one. If you want to do some healing touch, we can do that, blah, blah, blah. It was amazing and great. So they can provide these other additional services, some companionship, maybe take the person outside safely to get some sunshine, things like that, depending on the case, obviously. So those, people are amazing. The other amazing people that I have had the opportunity to work with are counselors, and there are two types of counselors in hospice. And I don't want you to get nervous with the titles. These are the titles, assigned by Medicare and assigned according to their specialty, but I need to emphasize again that care is tailored towards the patient and their family. So both of these titles and these professionals are medical social workers and spiritual care counselors. Now, again, I gave my little spiel before, my little disclaimer, because I don't want you to get worried or freaked out or kind of turned off by these titles, because a lot of people say, oh, I don't need a spiritual care counselor, or I don't need a medical social worker. I want to tell you, a medical social worker is not going to come in your home and call APS on you without talking to you. If there is a care issue, most people, I'm saying that because most people equate social workers with calling CPS or APS. They do so much more than that, by the way. But, a medical social worker is never going to come in, a nurse is never going to come in, any hospice personnel is never going to come in and just call APS without talking to you. It's their job. If hospice is already involved, they are required to talk to you and educate you on proper care, things like that, before engaging with another resource like APS. And you have to think of APS as a resource, by the way. So medical social workers, they are there to provide really extensive, thorough assessments. If someone who was on hospice if they're in the military, if they were in the military, or if they were a Holocaust survivor. There are certain things that they can interview the family or the patient on, and other therapeutic type of assessments and care that they provide that is much more in depth than you could ever imagine, because they're looking at the anticipated grief and all of the grief that can be possibly compounded or complex type of grief, and how that actually, is going to happen and occur throughout the whole grieving process, before and after the death. So they do so much more in terms of therapeutic communication than I can even explain here. It's a wonderful practice, and you need to use them and benefit from them and their care. The spiritual care counselor, in addition, is not going to come in and tell you what to think, what to believe, and all that kind of stuff. They're going to work with you. Should be asking you, what your thing is, what do you hold on to? Because for someone it may be nature. It may not be a certain religion per se. It may be things like they connect with nature. And so that spiritual care counselor will talk to them about, well, let's talk about how we bond with nature and how can this bring you comfort, things like that. And talk to the patient, whether they're awake or not, about spiritual distress. And I talk about why certain patients take longer to die. This is why you need spiritual care counselors. You can see that video for that. So those are kind of the general hospice staff, core staff, but that you also have your medical doctor, PA, and or nurse practitioner. And these people, they will also come to your home. They can come when you have to recertify a patient for hospice care, which is basically saying after someone has been on hospice for a certain number of months, you have to be assessed again to make sure that you remain appropriate for hospice care, okay? So, one of these people will come out and recertify. And what's great is that not only will they come and just, assess the patient, make sure that they're appropriate for hospice care and should continue to receive hospice care, but they can also address clinical concerns then or even near end of life or any other time in between. They can also be the attending, meaning that they can be the main doctor, main provider for that person at the time. So you can just go through one person, one doctor, for everything that you need in terms of, if you need a certain order for something or, certain treatment, you basically can work with that one person. You can still work with your other doctors that you worked with before, but you need to coordinate your care with hospice and let them know if you're seeing them or not. Okay, so you've got these amazing people. The other types of people that are amazing are things like hospice volunteers. These hospice volunteers are incredible, and they are skilled in so many things. They can be skilled in things like, also aromatherapy, healing touch, but, energy work and things like that. But they may be good. They may be trained in hypnosis. They may be trained in pet therapy. They may be trained in music therapy. They may be trained in art therapy, things like that. They also can do things like bring meals for Thanksgiving or, bring you an In-N-Out burger. We've had all these types of things and much, much more. There's been so much that we've been able to do in my previous life before I moved overseas here. So there's so much to hospice care, and by goodness, if I missed something, please just put that in the comments. But I just wanted to give you a quick rundown. I really wanted to keep this under half hour because I know attention spans out there, especially if you're overwhelmed, a half hour is just more than enough. Let me know if you have questions. Let me know if I can clarify anything for you. I realize that I've been working in this sphere for 15 plus years, 20 or so, in the entire medical field, in addition to my hospice years. So I realize that I am coming from a different vantage point. And so while I really try to make sure that I explain things and make things really clear, I understand that I may miss something in terms of the clarity. So I really want to make sure this is helpful to you and that you get something from it and that you feel a little bit more confident with the more information you have and maybe a little bit more prepared. Okay, I'll talk to you soon. We'll continue to normalize these conversations and education about death and dying so we die better at end of life. And in the meantime, also live a really rich one until we get there. Let's talk soon. Bye-bye.